Now by Dr. Bharat Pankhania from the University of Exeter, who has over 20 years of experience in the control of infectious diseases. Doctor, thank you so much for being with us on the program. What are we learning about the coronavirus and how it affects our body in terms of causing these additional complications?
As you have clearly identified, we have a problem with this virus in that not only is it causing death primarily by making the lungs non-functional, by having a severe pneumonia, but on top of that, it is causing damage to the kidneys, the brain, the heart, and other organs, as well as presenting with Kawasaki. There's a severe inflammation in children. So what we need to do is develop a register of all the people who've had a coronavirus COVID-19 infection and then follow them through. I think we're going to learn a lot about chronic diseases as a result of a coronavirus infection.
Right, so are we looking at lifelong health issues for people who have severe cases of coronavirus? And then what about people who have more mild cases? Should they be concerned as well?
We need to follow everyone up because we don't know about the behavior and the long-term behavior of this viral infection. So it is imperative that we at least start recording and then looking for signs and symptoms of are these coronavirus-related ailments that are appearing 6 months, 9 months, a couple of years later. And if we start doing it now, we will be in a better position, and we need to do it urgently.
How challenging does it make this for doctors to treat this illness, that we have a set of symptoms that indicate you have coronavirus, but it seems like all the time we're learning about new symptoms or new health effects as a result of coronavirus? I mean, it's like a puzzle that just keeps changing and changing.
It is a puzzle, and it just clearly identifies one important thing. And that one important thing it is identifying for us is this coronavirus is not only a respiratory illness. Whilst it knocks your lungs out, and that is the way people succumb to other organ failures, people who recover from a COVID-19 infection may be left with other long-term sequelae as well. And that is why we need to have that open scientific mind and keep an eye on, what else is this coronavirus doing to the people that it infects.
I want to ask you about something that's really baffling. And as we know, many people don't have severe symptoms from coronavirus. And to help lessen the burden on the health care industry, people have been told don't go to the hospital unless you have severe symptoms such as shortness of breath. I know from personal experience, not from coronavirus, but it was a year ago I was in the hospital with a collapsed lung, and my oxygen level never dipped below 97%. And I was really struggling to breathe at 97%. But I'm reading about patients who are coming to the hospital completely lucid and their oxygen levels are as low as 50%. How do you explain that?
I think it is a case of they slowly but surely acclimatize to running on low oxygen levels. So when I did respiratory medicine in a coal mining area of South Wales in the United Kingdom, we kept people alive with pretty low partial oxygen pressures. People do get used to running on that low level. Of course, it is not good for people. And the other thing that I'm very concerned about is people may, therefore, as a result of exactly what you've said, present late to their doctors and to the hospital. We need to have this watchfulness about people who are suffering with the illness, but at home. We need to watch them in case there are inflammatory markers going up, telling us, get this person into hospital sooner rather than much later.
All right, we'll leave it there. Dr. Bharat Pankhania, thank you so much for sharing your thoughts with us today.